And I'll turn it back over to Kiki to give a little bit more of a personal story as it relates to the impacts that we're having both in a workforce and a small business investment.
Thanks, Adam. Kiki Turner, I'm the Deputy Director of Communications for the Department of Finance. I know we talk a lot about numbers in these kinds of presentations. We're finance, we're numbers people, but we know that behind these numbers, the dollar amounts and decimals and data points are really the people who voted and advocated for these projects, the people who will benefit from them once they're completed, and the people that are delivering this infrastructure to us. We know that now more than ever, it's important we continue to put people at the forefront of this program and celebrate the faces that are really behind the projects and the program. So we want to take a moment and do just that. Shakina is one of the 4,900 people that Adam referenced, who is part of the Denver construction pilot. She, after being encouraged by her mother, gotta love mom, she attended a city-led career fair where she successfully applied for an apprenticeship program in May of 2019. And by that fall, she was accepted into the program and working on an Elevate Denver project. It was actually the Denver Health Outpatient Medical Center. She constructs air ducts, and she was telling us she quite literally controls the way that the building can breathe. She moves airflow from floor to floor, and now, more than ever, she realizes just how important her work has been to help serve the essential workers that will fill that building. She told us that before she had applied for the program, she was kind of a jack of all trades. She had tried a lot of different jobs, from nannying to restaurant work, and nothing really stuck. She wanted something that would provide her more stability and more of a career trajectory. And so far, she says she's really found that in this apprenticeship program. She's about halfway through it today, and she's already thinking about her future and how she would love to own her own business. She's contemplated an all-women construction firm, which I think is great. So I think she's happy to be in the program and looking towards the future. We certainly hope that she accomplishes those goals and can own her own business, because then we'll be able to work with her as one of the small minority and women-owned businesses that we've grown relationships with. Adam mentioned this a little bit as well. Through a variety of methods, we've been able to kind of grow a community of local businesses to help deliver these projects. One of those businesses and one of those people is a man named Bob, who is a Denver native and has owned his construction firm here for over 25 years. And he told us that bond projects are really his company's bread and butter. He, as a taxpayer in Denver, understands just how important it is to stay on budget, on schedule, and deliver projects that will really last for decades to come. He said he used to take the number 6 bus to get to school as a kid growing up, and now he drives around Denver and drives his grown children crazy by pointing out all the different projects he's worked on. He's currently working on 2 different libraries here in Denver, and he's excited to be able to give those to his community. So we do our best to sing out the praises of our workforce and our small businesses. We certainly want residents to know that by approving something like Elevate Denver, they're going to get infrastructure, but it's also an investment in our workforce and in our small business and people like Shakina and Bob. So we just want to take a moment to introduce you to some of the people of the bond program. And now I'll hand it back to Scott Richrath to get into some program and project highlights.
Great, thank you, Kiki. Can you hear me okay?
We sure can.
Great, this is Scott Richrath. I'm the Elevate Denver Bond Program Manager, and thank you for having us this afternoon. And before we take a look at what projects comprise issuance number 4, I think it's important to look at the great work that's been accomplished to date through the first 3 issuances. There are nearly 500 projects within the Elevate Denver Bond Program that comprise that $937 million that Adam referenced. 106 of those are already in progress, and another 71 have been completed. So nearly 180 or more than a third of the projects are in some form of progress, if not completed to date, which isn't too bad. This is approaching the end of year 3 of the 10-year program. To show you a few indications around momentum that we're gaining here as we start to close out year 3. Of the 71 projects that have been completed so far. 40 of those have been completed here just this year. And also for context, Adam had mentioned a couple of other important numbers, that we have 166 primes or subs in construction from the MWBE community, and another 39 on the professional services side. Those represent significant upticks from just the last 6 months alone, where we were only at 16 on the professional services side and 115 in construction. So we're definitely gaining momentum in a number of areas, and we thought that this project here, 47th and York, pedestrian bridge that you see on the right side of your screen, is a great indication of projects that have been prioritized by the city, move forward, and have helped to benefit, in this case, school children getting safely across that freight rail track every day to and from school, and have also improved safety and mobility throughout that near North Denver area. Moving again to the next slide, we'll take a look at a couple more projects that I'd like to highlight. In the top half, we have the West 13th Avenue bond project within our transportation and mobility purpose. Many of you may recall that you approved the intergovernmental agreement for the city to enter into a venture with Denver Housing Authority to provide a number of benefits to that Sun Valley neighborhood. Not only were we able to help to accelerate the infrastructure components from the transportation side there as you move from downtown across the South Platte River into Sun Valley on West 13th, but also partner with Denver Housing Authority to help them bring the several hundred additional affordable housing units to that neighborhood. In the lower half of the screen, some of you may recognize this. This is a recently completed bike project. It's one of more than 100 miles worth of bike lanes that we will have from both Elevate Denver funding and Capital Improvement Program funding, this one on 14th, just south of the Wellington Webb Building. Let's move to the next slide. We'll show you a highlight of some of our larger recently completed projects. Denver Art Museum is pictured there on the left, and it's one of several that you see listed on the right, where our cultural and Denver Health partners were able to put to use the donations they had received to help pay for design and ready projects. And then with approval of the voters in late 2017, we're able to leverage the Elevate Denver bond funds that were part of first and second issuance. And all of those projects are either at completion or projecting completion by the middle of next year. So great progress there when we talk about some of the construction work that's been done by our various communities having been completed already. A lot of it is on these great projects. So then last project I'll touch on as kind of a retrospective before we look at the list of projects in issuance 4, Paco Sanchez Phase 1 at the Paco Sanchez Park, just west of that West 13th Avenue project that I touched on. That was able to be completed from prior funding, from prior bond and city funding, just as we headed into the Elevate Denver first year of the program. And then Elevate Denver bond funds contributed toward second phase efforts. So the northeast portion of that park was completed in Phase 1. Southwest portion that we show you there brought in new play elements to the folks of that neighborhood there on the near west side. So that really is the retrospect of some of the highlights of our projects that have been completed through issuances 1, 2, and 3. And now we're going to take a forward look at issuance 4. Just to set context, this pie chart that I'm showing you is the $937 million of the total bond funding spread across the 7 purposes for the entire 10 years. As you work counterclockwise, starting with the green, you've got your first 3 issuances to date, which approaches that $400 million number. And then the 4th issuance that is proposed before you today is $170 million nearly. Now, while that 4th issuance is not quite the size of our first issuance was over 50% committed to culturals and Denver Health. So in and of itself, 4th issuance now represents by far the largest issuance of city-led projects to date, which, as Laura mentioned in the work numbers that will put people to work on this effort, nearly 75% of which will go toward construction. So let's take a look at the overview, and this is a list of the 7 different purposes with total funding in issuance 4 proposed on the right. Culturals and Denver Health now stand at 0 because they have been fully funded. Those projects are complete or near complete. And as Adam pointed out, that pie chart of the 937 that he showed shows nearly half for transportation mobility. And here we have 95 million of the 170 million going towards safety and mobility improvements throughout the city. So I'm going to break this down across the 5 purposes that do have funding, starting with the transportation mobility purpose. I'll have 2 slides on this. The first one is what we call the named bond projects. They're for a specific improvement in a specific geographic area. And you can see funding for many of the 20 named bond projects that we have spread across several districts. Some of this is for design, so these will be the first elements of the project that we're undertaking now. Some is for property acquisition, right-of-way, and real estate, but some of the large dollars are for construction. In some cases, we have multiple phases that will be completed with this list. The West 13th Avenue project, as one example, where we have partnered with Denver Housing Authority, will have completed its funding here with this issuance and will allow that completed project to finish up. On the next slide, I'm going to show you what we call the citywide projects. For any given row here, we have a drop down, if you will, a number of projects that are occurring across the entire city. Pleased to say that every single district is receiving multiple projects with this issuance, whether it's design, construction, or a combination. The good news here is citywide bikes and citywide sidewalks are both receiving by far their largest allocations, both over $10 million. And you can see we've now progressed as a city with both Elevate funding and capital improvement funding from design to construction on the bikes. We still have a little bit of design. We still have a fair amount of design work yet to go on the sidewalks, but others are moving into construction as well. So that brings you to the total of 95 million for transportation mobility. On the next slide, I'm going to show you 2 different purposes I'll touch on very quickly. The $14 million that you see there for Police District 5 would enable that project to construction. That is the project north of I-70, west of Peoria, that would adjoin to the 911 call center. In the lower line, the ADA projects is a small number in this issuance, but I want to set a framework for that. We did issue $5 million previously for ADA from our $10 million total allotment. And that $10 million is designed to accomplish a portion of the work that's needed throughout the city, not all of it. Other funding sources will need to be added to that 10 million. But the good news is that first 5 million is underway, and in many cases through construction on some of the projects. Right now we're seeing some cost savings that will be paired with this 500,000 to prove up design for the next wave, and the next wave will then bring forward the $5 million to complete that ADA line. And we're hopeful to see much of that in the following issuance number 5. 2 more slides that I have here. The first one is on the libraries and the central library renovation. When all told, should come to a $50 million renovation, one of our largest bond projects. What you're seeing here is the $23 million, which would complete the Elevate Denver funding portion of that. Much of the construction is already underway, and significant amount will begin in 2021. And then the Friends of the Library, in addition, are raising funds up to another 12 million to bring the total 38 million of Elevate Denver, 12 million of Friends funding to $50 million. Final slide I'll show is with Parks and Recreation, where we would complete the Green Valley Ranch indoor pool with the $14 million there that you see for construction. Like transportation and mobility, you have a number of citywide improvements that can range anywhere from $50,000 to $2.5 million, but many of those improvements are occurring within the rows that you see for neighborhood park improvements and recreation center improvements. Westwood Rec Center has a small amount. That's because we had $10 million in the last issuance, enabling us to acquire more than $5 million in real estate. And this will provide additional funding to that previous 10 million in order to
Elevate Denver bond projects that Scott just talked us through. The not to exceed interest rate is 4.5%, though we anticipate coming in well below that. The current market rate is around 2.4% and will be determined on the day of pricing. The final maturity on this issuance is in 2039, so it'll be a 19-year term bond. And the city has AAA ratings currently on our GO bonds. We will be going through the ratings process here in the coming 2 to 3 weeks to obtain ratings for this upcoming issuance. As you know, with all our financings, the final par amount and the interest rates are determined on the day of pricing and will be dependent on market conditions at the time. Next slide, please. I believe this is the final slide. So if this item gets approved out of committee today, we would be at Mayor Council on October 20th, first reading on October 26th, and second reading on November 2nd. And assuming council approval of the issuance.
Well, good morning, everyone, and thank you for joining us for this COVID-19 response update. You know, well, good morning, everyone, and thank you for joining us for this COVID-19 response infections here in Denver. What we are seeing across the country is alarming. Many states and cities are experiencing dramatic increases. What we are seeing across the country is alarming. Many states and cities are experiencing dramatic increases, and while in Colorado and in Denver, we're doing better at our last places. We do have our own challenges. Been seen over these last several weeks. As I noted this past average daily case rates, our last update, hospitalizations, increases we have been seeing over these last several weeks are concerning. Average daily case rates for average number of daily cases we're now seeing that rates are concerning. We're even, in fact, higher than average we have been, or we're higher now seeing that we've over the course of this pandemic. So today, we are issuing public higher than we've ever been as additional steps over the course of this infection rate. So today, we are issuing 2 public health orders as additional steps to get this infection rate increased back under control. Face coverings and the first public health order will be effective immediately and be in place until further notice. Face coverings and the second order and will be effective immediately and be in place until further notice. Unregulated settings. The second order, reducing that number from 10 to 5, allowed to be in effect until November the 16th. Reducing that number from 10 to 5, administrator, and will be in effect until November the 16th. Just a bit, just a short moment. We're taking these additional steps to provide more to reduce the spread of this virus in our community. Just a short moment. We're taking these additional steps today. Several to reduce the spread of this virus in our community because right around now, and we must take these additional steps over the next 30 days, Halloween, and do the hard work that's right around now, and we must take enjoy the additional steps over the next 30 days. Like I said, do the hard work that's needed now, so that we can enjoy the holiday seasons with our families. Increasing caseloads, like I said, hospitalization rates and positivity rates down. If we don't bring these increasing caseloads, hospitalization rates and positivity rates down, and that would be devastating. We likely will fall backwards on the state's safer and home steps to level 3. We're aiming to strike a balance between keeping people healthy and frankly keeping Denver's economy. We're aiming to strike a balance. We don't just see between keeping people healthy and frankly keeping Denver's economy get infected, go out, and if they don't just see an infected a spike in groups remain isolated to one. So please, people get infected, broken record, and if they don't follow public health guidelines, your go out covering and practice social distancing. I read a letter from the White House this morning. I read in it, there were some recommendations, and it said, please consider wearing a face covering. No, the reality is your favorite local restaurant's ability to survive this pandemic depends on you wearing your mask and social distancing. Your favorite local small businesses' ability to survive this pandemic depends on you wearing your face mask and social distancing. Your ability to enjoy being able to go to one of your favorite parks and be in the space depends on you wearing your mask and social distancing. And since this increase in cases isn't just happening in Denver, I also want to strongly encourage our regional partners to take similar steps. This will be much more effective if we do this together, of course. We're going to take a step back and do what we have to do. So do what we have to do now so that we can get back where we were with low numbers and optimism that increased capacity at our favorite places as we were all able to enjoy just a couple of weeks ago. And with that, I'm going to turn it over to Bob McDonald, who will add more specifics to the two orders. Bob?
Yeah, thank you, Mayor, and good morning, everyone. Thank you for being with us today. I want to share my screen here, and I want to start out by talking about a little bit what we're seeing across the country. You can see here how various states are struggling a little bit more than we are here in the state of Colorado, and many communities struggling a little bit more than we have in Denver. Denver's never been in a situation in which some of these other states are, where we have very, very high incident rates, as high as what you see in this map here. But we are quickly heading in that direction. So it's very important that we adhere to the existing requirements that are in place and to the ones that will be rolling out immediately today. You can see here that all around the state of Colorado, we have states that are much higher in their incident rate. When you take a look at the map in terms of positivity rate, again, Denver and Colorado is doing better than many states, but our positivity rate is rising. We need to keep it below 5%. That's one of the metrics that is looked at in terms of the restrictions that might be imposed upon Denver and the state of Colorado. When we look a little closer to home here, you can see this. Many of you have seen this repeatedly. This is the epi curve for this virus, and you can see how it's responded to the various things that occur in our community, both with physical distancing or eased physical distancing, enforcement, face coverings, holidays, and what have you. And you can see here over to the far right, we are higher than we've ever been, to the mayor's earlier point. Our 2-week cumulative incident rate is 265, meaning that if you look at the number of cases that occur every day, you add that up, divide by 14, that's our average cumulative incident rate for a 2-week period, and it continues to climb. It's climbing faster than it has since the start of the pandemic. When you look at the three metrics, case rates is one of the metrics that we look at. This is the state's dial. It's often referred to the dial. It's on the state's website. Anyone can get in and look at this and see how various communities, including Denver, is doing with managing our case numbers. And with every one of these phases of the dial, there are associated restrictions. Right now, we are right here in level 2 of the safer at home part of the dial. And when you look to the right of this, you will see that with the three metrics, we are well beyond the safer at home level 2 phase. Over here, you can see our 2-week cumulative incident rate is much, much higher than our level would suggest. This 257 rate is a little different than the slide you just saw previously. That will likely be updated today. You can see the other two metrics. As I said, we need to stay below 5% with our positivity rate. Otherwise, we are going to move in the wrong direction with that metric. And the number of days that we are stable with hospitalizations has been declining. Just a couple of days ago, I was looking at this, and I believe we're at 11 or 12, 11 days, I guess. So it happens quickly. These things bounce up and down, but the number of days continues to decline in terms of stable hospital rates. So what happens if the other two metrics move in the wrong direction along with the case rate metric? We will see reduced capacities for restaurants. Last call for alcohol sales will be earlier. There'll be reduced capacities for a wide range of manufacturers, offices, a wide range of retailers, further restrictions on outdoor settings and indoor settings. So To avoid getting to that point, the department will be rolling out, again, 2 orders that essentially require enhanced face coverings in venues where you've not seen it before. So effective immediately, face coverings will be required in all outdoor settings now, in addition to indoor settings, with a few exceptions. If you are outdoors by yourself, then you will not need to wear a face covering. If you are outdoors with your family members, those that are within your household, you will not be required to wear face coverings. If you are outdoors, congregating with other people outside of your immediate household members, you will be required to wear a face covering. So I want to clarify that a little further. If I leave my place of employment by myself to walk down the 16th Street Mall, I will not be required to wear a face covering. If I were to leave with some coworkers to go down to 16th Street Mall, then I would be required, all of us would be required to wear face coverings just as we do in the work setting. Organized athletic programming is exempt from this requirement. So when I say organized athletic programming, that would include, college football, high school football, youth soccer. The reason that they're exempt is because they already have restrictions in place, and they are required to submit plans, or put plans in place, I should say, that monitor many things to make sure that it limits the spread within their athletic event. We are also going to issue an immediate order that further restricts gatherings from 10 to 5 people. So right now, the limit in a public gathering, whether it's the 16th Street Mall, our wonderful parks here in Denver, no more than 5 people should be gathering. We need to limit that now, further restrict it to 5 people. It is at 10, we need to move it to 5. Again, this would not include members of the household. So if you have more than 5 members in your household and you're at a park, that's okay, but that would be the limit. Then you would not be able to mingle with other groups within the park. Again, non-organized athletic events would be exempt from this for the reasons that I've already mentioned. But I want to touch upon organized events would be exempt, but non-organized events would not be exempt. And what does that mean? That means the pickup game of a large group of people playing football in the park would not be allowed. Anything above 5 people on a basketball court is okay. 5 people, more than 5 people playing football or playing basketball would not be okay. For any sport in which you cannot physically distance, there would be a face covering requirement. And then the same would apply for gatherings at work. A gathering of 5 people would be the limit. Now, having said that, I want to encourage our businesses, particularly in office settings, if you can go virtual, go virtual. If you can hold meetings with less than 5 people virtually, do that. That's only going to help us out. And with everything that we're implementing here, enforcement is as important as ever. We'll be working very closely with our Department of Safety to ramp up enforcement even more than it is now. We have focused a great deal on regulated settings, businesses, and that sort of thing, but these things will be enforced against individuals if need be. So if people are violating the congregating order in a public setting, they run the risk of enforcement. And with that, I will turn it over for questions.
Do you have any questions?
This is Sonia with 9. I just have a quick question. How will the enforcement be happening in Denver? He said that Bob said that there would be more up enforcement. So what will that look like?
Yeah, thank you for the question. We are working very closely with the Department of Safety to make sure to partner with them to check all venues that are under this order. What's going to change?
Bob, turn your camera on.
My apologies. Thank you again for the question. We are currently working with the Department of Safety, and we have been very early on to make sure that there is enforcement with all of these public health orders. We are going to increase the number of members from the Department of Safety to proactively check our parks, the 16th Street Mall, many places in Denver that are popular for gathering. And again, if individuals, even at the individual level, if they are congregating in numbers that are not allowed, they would run the risk of being issued a summons to court, and that activity, that large gathering, would be broken up. Members of the Department of Safety are also going to proactively or respond to calls where there are violations of the public health order, even in residential settings, which I want to clarify that this does apply to residential settings. So if a member of a household, if there are 4 people within that household, they could have a guest over. If there are 3 people that live in a household, they could have a couple of guests over. If there are 7 people that live in a household, they would be at the maximum, and for the next 30 days, they would not be allowed to have additional guests. These orders, the face covering order, will be in place until further notice. The reduction on the limit of 5 people in a gathering will be effective for the next 30 days. And then 30 days from now, we'll revisit where we are with our data and respond accordingly.
Let me just add, I always enjoy the media's question around how you're going to enforce. And obviously, these orders set the legal framework for the civil enforcement of the laws as we have announced them here. But equally as important is really the fact that we want to send a clear notice and call for personal responsibility, that we are, as a county, brimming on the edge of a crisis that could further endanger individuals' health, as well as damage our economy. And so as much as we want to give people the notice that we have now put in place a legal framework to enforce certain orders to keep people safe, we want to raise the flag and sound the alarm that we all have to take personal responsibility to manage our lives and our activities accordingly so we can keep each other safe and we can make sure that people are able to continue to work in this economy. So I just want to underscore that very important fact as well.
Hey Bob, it's Ed Seelover with the Denver Business Journal. I'm wondering if you could extrapolate a little bit more on what the 5-person limit in workplaces means. I mean, I think it's obvious that, hey, meetings should be 5 or fewer, but how far does that go? I mean, should that be restaurants should have 5 or fewer people working behind the counter in the kitchen at any given time? Or how do you determine when 5 people gather in a workplace?
Yeah, those businesses that have specific allowances already, they will not be impacted. So 10 people in a restaurant, say 10 patrons sitting at a table, that would not be impacted by this. And the reason for that is because there are many, many other protocols, restrictions that they have to follow. There's regulatory oversight. There are many things in place that you do not see in a social setting. And so these orders will not impact those businesses that have separate allowances but separate restrictions that they would have to follow.
Bob, can you talk a little bit about
Go ahead. I also want to just briefly say that these restrictions do not apply to classroom settings. Our department is working very closely with our partners at Denver Public Health and the school systems to manage how this virus reacts within those settings.
All right, go ahead. Thanks, Bob.
Yeah, Bob, can you talk a little bit about how testing factors into the increased rates? Obviously, the city is doing more testing than previously in March and April when rates were pretty high. So can you talk a little bit about can you put that in context about how that relates to the higher rates right now?
Yeah, well, that's a great question. Very early on, that the Pepsi Center was stood up to get in front of this, to collect as much data as we could. And then again, we recognized that was a invaluable approach, but we needed to place our testing sites in more strategic locations where we have underserved populations. And we've been very successful doing that. the site that we stood up along the northern corridors of Denver. Each of those sites, just those 2 sites alone, are doing roughly 1,000 tests a day, almost half of what the entire Pepsi Center was doing. So I think that strategy of moving the Pepsi Center to smaller but more strategic locations was the right way to go. With respect to positivity, you know, a lot of things can play a factor on that. Certainly the number of people that you test, who you target in terms of testing. And then, you know, if you open it up to everybody to get a test, you know, positivity rate goes down, especially if you have a lot of people getting a test. If you're trying to target outbreak settings or more communities where we see a high percentage of cases, then positivity rate goes up. That's one of the metrics that can swing quite a bit depending upon the approach that's taken. But we've been very successful so far with keeping our testing numbers up. CDC suggests, it's a guidance, CDC suggests that for a city the size of Denver that we do roughly 1,100 to 1,200 tests. A number of days ago we were at 3,500 for the city of Denver. That includes all testing, the wellness Winnie, our testing done by Denver Public Health, testing done by DDPHE, outbreak settings, and otherwise.
Next question.
This is Anusha with 9 News. There seems to be a lot of COVID fatigue right now when it comes to following guidelines. And we've heard the messages before of personal responsibility and taking care of others to try to get this under control. So, Mayor, I was wondering what you were telling people, what the city is trying to do to re-motivate people to keep sticking to these guidelines and to continue to follow it, especially with the new rules that were just announced.
Great question. And I think that along with a lot of the personal responsibility and kind of the wave of you know, challenge, somewhat success, challenges or spikes, flattening, what have you, however you look at it, you can also look at the various activities or moments in our society that kind of drive these spikes. So it is oftentimes these orders or tightening of the orders is really about responding and reminding people that we still have this pandemic within our society. For example, at this point, we have more young people going to school on campuses, more young people going to school in our buildings, more activity occurring, the fatigue you talked about, which we're all experiencing, and really desire to try to have some control over our lives. All that is contributing to this moment in time where we're seeing a spike, and our orders and our actions are really meant to remind people that this is real. And one of the other things that we do is to try to remind people the impact of not doing what we're asking everyone to do. The impact, for example, of, again, businesses shutting down, restaurants shutting down, that could absolutely be devastating to those businesses. We care about that stuff. Our kids, the fact that we want our kids to actually be in school, they learn better when they're in school. Adhering to these orders is extremely important to making sure that at least our elementary kids are back in person and getting what they need, and hopefully our older kids will be in Denver back in the classroom very soon. So there are cause and effect, there are consequences for us not following these orders, and our job today is really to put in place the legal framework for the civil enforcement, but also to, again, to sound the alarm that if we don't do these things, the consequences, quite frankly, could be devastating. So we just try to remind people that, and personal responsibility is the best way for us to handle that, and remind people we're waiting for a vaccine, but this is indeed scientifically proven the best vaccine we have right now to change this course of our trends and to make sure we're keeping each other safe.
Mayor, if I might add something to that.
Yes.
Yeah, thank you, Mayor. I just want to remind everyone that you know, there are many things that we can still do. It's okay to go to your favorite restaurant. It's okay to go for a run through the park. It's okay to play basketball in the park as long as you adhere to the guidelines. It's okay to go to your favorite gym. So many things that can still be done as long as we're following the right restrictions for those venues. So if you go to your favorite restaurant, wear your face covering to get in the door when you're seated, and ready to eat, then take your face covering off. And when you're done with your meal, and then put it back on and leave. So many things that can still be done. So I just wanted to share that.
This is nice at Bloomberg News in Denver. I have a question regarding COVID-19 and hospitals. Denver, of course, is a medical hub in the West. Are the hospitals with the outbreak in Denver now feeling any strain from rural areas, such as the outbreak in Wyoming, patients being transferred in, or other parts of Colorado, what have you? Thank you.
Bob, you want to answer that if you all have the information?
Yeah, sure. I don't have data in terms of how many people come from outside of state to get medical services here in Denver, outside of Denver, for that matter. I don't have that in front of me, but that's a reality that, we have residents outside of Denver that can come into Denver to our medical care providers. Right now, what I can tell you is that our hospital systems our cases are increasing. It is not critical at this point. There are ICU beds available, and that is not a serious threat at this point, but the numbers are going up. And so we're going to have to keep an eye on that. Of course, that's a critical component in terms of next steps, is the availability of our medical care providers to keep up. And along those lines, I just want to remind everyone what really is going to help keep those numbers down in terms of admissions to hospitals is to get a flu shot. Really, really critical this year more than ever.
Could you clarify something about the gatherings rules? So you said like professional and college sports have their own rules, and pickup games you'd need to have this 5-person rule. Where do intramural leagues fit into that? And also, if you say you want to meet with another household in the park, if you set up your family on one blanket and another family sets up its blanket 6 feet away, and you just kind of talk very loudly, is that allowed?
Yeah, great question. So when we talk about organized sports, we're talking about organized adult recreational programming as well. We're talking about organized youth soccer. Those things, those types of events that have plans in place, additional restrictions, do not, the 5-person limit does not apply to them. What we're still seeing that's really concerning is just large groups of informal gatherings in parks, sometimes upwards of dozens and dozens of people together, playing football, playing basketball, gathering for various reasons. That is what needs to stop. That's what these orders are targeted towards. In terms of your question about 5 people in one household sitting on a blanket having a picnic and being distanced from another family that they might know, technically that would be in compliance. However, we strongly encourage. This is not the time for even small groups of people to try to convene, but to stay apart. The more we try to do that, I think the more complicated and challenging it becomes with really spreading apart to the extent that we need to. Again, this is for 30 days, and we'll revisit this, but we would encourage, families to do things with your household members as much as possible.
Any other
time
questions?
for one more?
Yep, we got time for one more question.
I have a quick question. Right now, restaurants are allowing people to gather at tables of 6 or up to 6, I believe. So does that shrink now to 5 with this order?
No, the hospitality industry, 10 people can gather at a table. These orders do not impact that. Where there are specific allowances above the gathering of 5, this order does not impact that number in those specific venues. And again, the reason for that is because those venues, and we'll stay with the line of restaurants here, they have many, many other restrictions in place. There are people who are working there, they're enforcing them, they have plans for that. And so this does not impact them.
It's a really quick question for the mayor. Can we get an update on sanctioning camping? Is the city any closer to choosing a site in the city?
When the group has identified a site that meets all the criteria, they will actually bring that recommendation to me. I know they're out vetting several sites at this point in time, and so I'll wait on them to give me the signal that they're ready for us to have a conversation about a particular location.
All
Can we
right,
expect
thanks,
that by
everyone.
the end of the year
Yes,
before
Devon?
things get really
That's the
cold?
last question. Sorry, everybody. That's the last question we have time for. And we're sticking with COVID at the moment. So thank you very much for your patience, everybody. But that's the last question. Thank
you all.
Thank you.
Pedestrian mobility and a bike mobility program established within the Department of Transportation and Infrastructure, in which we look at how do we best prioritize our funding as it relates to our pedestrian